More doctors are now prescribing ivermectin as a treatment for COVID-19. Despite the initial controversy over the livestock version, ivermectin, made specifically for humans, is a popular prescription right now, making it very hard to find. KTK's Lauren Margolis spoke to a Tyler pharmacist who has seen the influx of prescriptions firsthand.
That's right, Casey. A pharmacist I spoke to earlier today says they currently have about 7 boxes of it left in stock, and they're constantly reordering more. A surge in demand they aren't used to seeing with this drug. Ivermectin is a drug normally used to treat parasite infections in humans.
We're probably on some occasions dispensing as much in one day as we used to dispense in 1 year.
That is before some doctors started prescribing it for COVID-19 patients.
There are a lot of physicians that are agreeing with the data that supports that. It depends on the data that you believe. There's also data out there that says it doesn't work.
Pharmacy manager David Davis says local emergency rooms have been prescribing it to help patients' symptoms.
The belief is that it works to treat the virus, to treat the COVID-19 virus, to slow it down and to help people to recover quicker.
Davis telling me it's also being prescribed as a COVID-19 preventative.
Some of it is a prophylactic or preventative use for COVID. We have had patients come in.
I spoke to a handful of East Texas pharmacies. All of them reported seeing an increase in customers coming in with prescriptions for ivermectin, one of them including Drug Emporium in Tyler.
Our supplier has run out of it on occasion in the past month, and so when we placed an order, they've been unable to fulfill the order.
Not all medical experts agree with the sudden surge in ivermectin prescriptions. A few weeks back, we spoke with Dr. Tom Cummins of UT Health East Texas, who warned of the use of the drug.
It doesn't work. It's not safe. It can cause a lot of nausea and vomiting, but the worst thing about it is it can cause liver damage, liver failure.
The human version is only available through prescription. Because of that, those eager to get their hands on the drug sooner are turning to the livestock version, something doctors and pharmacists advise against.
I cannot and do not recommend that you go to the feed store and get animal ivermectin. It's dosed for horses and cattle, and we're not horses and cattle.
But overall, Davis says patients have reported positive outcomes with the human version.
If your physician agrees and you're acceptable to that, then I would certainly, if it were me, I would certainly give it a try.
Davis says he hasn't heard any of his customers experience bad reactions to ivermectin. The one side effect he has heard of is a mild upset stomach. In studio, Lauren Margolis, KTK News.